Hello and welcome to the EduTalk series hosted by Biotone Edu Partner School Program, and massage industry experts. With the growing interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Dr. Dorothea Atkins, a holistic nurse and member of the American Holistic Nurses Association since 1999. She's a licensed massage therapist, educator, researcher, and facilitator of holistic self-help approaches for pain management, injury prevention, and wellness. Dorothea is president and CEO of HolosTouch LLC, where she combined her 30 years of nursing experience, education, and advanced muscle and massage therapy to create an at-home solution for chronic joint pain. Dr. Atkins developed the knee self-massage technique, which is published and continues to help thousands of people. Osteoarthritis has no cure and is the main cause of joint pain and disability. Current treatments, both conventional and complementary, focus on costly symptom relief. Let's listen and learn as Dorothea explains how self-massage is a go-to first step treatment for at-home self-management pain relief. Since 2016, Dorothea's self-massage education has successfully taught patients, healthcare professionals, and seniors effective self-care, self-massage techniques for relief of chronic joint pain issues. Thank you again. Please feel free to chat questions or comments during Dorothea's presentation, which he will answer at the end. We have a lot to cover. Dorothea, thank you. I know you're ready to hit that green share screen button.
Yes.
And I'm turning it over to you. I'll see you at the end of your presentation.
Yes. And share. And share. Hello, everyone. And thank you, Danelle, for your introduction. And I also would like to commend Biotone for their vision to assist the ongoing, ever needed education of us as therapists, healthcare providers, caregivers, as such, and also to guide us with the top massage massage oils and treatments that they do provide. Today, I am just so excited to present to you my proven research presentation on something so simple about self-massage. And that's one of the things that we just don't do. And after being a massage therapist, I realized that, my clients would come in and go to sleep and get up feeling so much better. And then we always kept the cycle going. So then I thought, okay, you know what? Let's see why these muscles, why I relieve the pain and it keeps coming back. And that's when I discovered that the problems, they don't know their muscles, and our healthcare system does not do too much about educating people about what they can do for themselves. So today we're going to learn about my journey so that we can understand what osteoarthritis is. We know what it is, but how come the ineffectiveness of the treatments don't really benefit our clients or our seniors? We're also going to talk about the costly CAM therapies and my research hypothesis, and you're going to learn the self-massage technique. Osteoarthritis is on the rise, as you can see In 2010, it was 27 million. In 2020, 32 million. And as you can see, by 2030, they research predicts that it will be 67 million people, or 25% of the American population would have some form of joint pain. As a result of that, the research, the CDC and the Arthritis Foundation got together to come up with these 4 solutions that they felt would help with the rise in chronic pain. So they have programs on weight management. They have exercise. They've spent a lot of money with exercise handouts that senior citizens agencies around in the United States used, wonderful handouts. And they come in and they talk about diet, and they also talk about how to prevent injury. But the problem is they talk about it, but they don't educate the patients or the seniors about how their bodies work and what they can do at home. So when we talk about weight management, well, yes, you can prescribe, you can talk about the types of food that they should have and such. But if they don't have the capacity to get to a supermarket, they eat what they can. And exercise is so important. However, many of them, if they can't walk, how can they get out and exercise? They don't talk about the type of sneakers or shoes to wear when they exercise. So when I worked with them while I was promoting exercise, I started teaching about their feet and how they can better take care of their feet, and about diet and injury prevention as well. We're going to learn more about that later. The current medical treatments, injections, physical therapy. Now, this self-massage technique is not in place of physical therapy. Please understand that. None of this is in place of this. If we can teach people what they can do for themselves at home, then they can get to physical therapy and participate in their exercises that they suggest. Just think about they have you say, they encourage people to use ice or heat. Well, people put ice or heat on the knee joint. Well, that is a bone, and the heat is not, the bone is not the problem. It's the muscles that move the joint, not just the fact that the joint has some difficulty moving. Exercise for weight loss. Again, if they can't walk, they can't lose weight. Meditation. I don't know if you've ever tried to meditate when you're in pain. When you quiet yourself down, then the pain, just all the distractions that the person may be using comes to the surface, and you can't concentrate. And yoga is fine if you can get down on that floor or get up, or if you can work with the yoga in the chair, that's fine. But a lot of people cannot do that with the problems they have with the muscles, not with the joint. And the same principle with Tai Chi. Tai Chi is done with the knee partially bent, and that Tai Chi has been proven that it does help with arthritis for those who can do it. Now you see the little joke about the pharmacy and medication. So if you got a big pill and which also contains the amount of treatments for the side effects. Now this is just an example of my study. My study took me 5 years to do. I financed it myself because I couldn't get anyone that would believe in what I was doing. And many times when people or organizations finance your research, then they own the rights. But my research, what the hypothesis was, there's no cure for osteoarthritis. Muscles move joints. No attention is placed on the muscles. No at-home self-care treatments or education is done. And pain management it is costly, and treatments are only most times temporary. So the self-massage technique itself these are the benefits. The benefits is it is number one, groundbreaking. And because no one seems to have thought about the muscles, and I've thought about the muscles because I was a massage therapist, and I noticed that when I was massaging, that the muscles relaxed and enhanced mobility, followed. But I thought, why can't I teach a person to do this at home? It did not decrease the number of my clients at all, but it certainly helped the overuse of my hands and such. And I began to teach my clients muscles. And it can be done anytime and anywhere. You don't have to take your clothes off. It can be done right on top of your clothes and with minimal precautions. It's easy to manage, and there's no prescription needed. Now, this is the foundation. The quadriceps here, as you can see, the fourth muscle is underneath the rectus femoris. You see how the muscle comes down and forms a tendon, and the tendon crosses the kneecap. Well, if this muscle is tight, or if this muscle is tight, it's going to pull on the kneecap. And so people rub the knee thinking that is where the source of the pain is, but they never release this muscle. And let's look at the function of the quadriceps. They provide the extension for when you walk. They stabilize you as you stand. Proprioception is if you put your leg out, you have a sense of where your leg is, and it's a shock absorption if you should fall. So you see these muscles here. Now, when we worked on the muscles, the relief was immediate. And why is it immediate? Because let's look at it. Arteries, nerves, and veins run through muscles. So if the muscles are tight, they run through and on top of your muscles. If the muscle is tight, it can compress the nerves. It can compress the circulatory arteries and veins and have a cut down on the circulation and prohibit the decrease in the swelling because of the tension on the muscles. Now, and also everybody's body is unique. Some people's muscles are naturally toned all the time. Some people are very flexible. Some people, when as a massage therapist, I began to palpate the differences in muscles. But as you can see, muscles, their body structures are different. So you can't say that everybody is going to do the same thing, should do the same thing, and will benefit in the same way. Okay, these are the precautions. Again, if the doctor says no, then that's okay. Oh, oops, sorry. If a person is on blood thinning medications, that's a precaution. Previous research or previous or recent hip or knee surgery, I was against medical advice if they have enrolled in the physical therapy rehab program. And what I do is I get, when clients come to me, I get them ready for rehabilitation so that they can do the exercises. And if they're unable to safely use their arms or hands for this self-massage technique. This is an example of the knee joint. And the knee joints, you can see how it moves up and down. And this is the direction. And you can see how it moves really quickly. But the problem is that if what is moving is the joint, I mean, the muscle goes into the tendon and the tendon goes into the bone. So if the muscles are tight, it's going to cause the joint to show up on x-ray with some abnormalities. Now, when we talk about the basic techniques of the self-massage, there are actually 4 basic steps. Tapping. And the tapping is if you're sitting where you are, but if you just take your hand and tap down your arm, you'll get an idea of what the tapping does. The tapping relaxes the muscles and increases the circulation and gets the muscles ready for work, for what it is that you're going to do. You cannot hurt yourself. Your body knows as you. It's just like you can't tickle yourself because, again, you can't sneak up on your body. So the first step, and you're going to see it in the video, the first step is the tapping. The second step is a glide stroke with the heel of the hand. I'm just using it on my arm, but it's the heel of the hand. You just glide down and we tap on the quadricep and we glide down using the heel of the hand, and the leaning forward gives you the pressure that you need to enhance the pressure on the quadricep muscle. These muscles are strong, and because they're strong, you have to glide down the top, the outside of the muscle, and the inside. So we use the opposite hand to get to the inside. So it's 4 areas of work. Now, you can't ignore how a person sleeps. If you don't sleep in the proper positions, no matter what we do in my office or any physical therapy office, if they go back to sleeping in fetal position, these muscles are not resting. And so that's the first question I ask when people come to my office. How do you sleep? What position? So if you have these positions and sleeping on your side with your arms flexed, heaven help if you sleep on the stomach. I tell them I will not work on them if they sleep on their stomach, because that's the psoas muscle, and that problem will not go away. I know that unless they change the position. If you sleep with your arms over your head, you can see, again, think about the muscles that you're pulling. And again, this fetal position, you're shortening psoas, and your head weighs 10 pounds, and you're going right into fetal position. And this is attested. I had it on video, but a person who can feel the difference. In my office, I have all these pillows so they can experience it, because you could tell a person, they will not believe you. But when you see the wedge pillow and a contour pillow under their head and a pillow on each side of the arms, the joints are supported. And the wedge pillow gives a person the lift so they can breathe easier. And just like massage therapists, we always put a bolster underneath their knees. I put a firm pillow underneath their knees. If they lay on their side, the pillow goes from their knee to their ankle to support that. And you can see how the contour pillow, and this is just an upper view with that. So this is really fast, So in summary, self-massage is for pain management, and it's the first and only, and it has been 14 years since my research. And finally, any researcher who has done the first research, when a university thinks that your research is worth duplicating, that is the ultimate compliment. So University of Florida has considered my research as valuable, and I'm working on their team. So they have the money and the resources, and I'm just so glad that my research is going to get that national attention that it deserves. And I'm coming back, and so I'm going to stop sharing this. Oh, and now we're going to go to the video. So I'm going to stop sharing the screen for a minute, and then I'm going to go back again, because when we practiced, I had to do it twice. Now, and now I'm gonna share the screen again, and now we'll get to the video. The video is only about 3 minutes. Okay, and you're sharing the screen. Okay, all right. Oh, what happened here? Okay, and here we go. Now, again, when I did this video, I got 52,000 views, because the need was so great. So let's see if this will work.
Technique
Okay.
is based on the principle of using the heel of your hand and your upper body weight.
I do wear an anatomy
forward,
suit.
and you're working on the quadricep muscles only. These are the muscles that extend the knee as if you are kicking a ball. And this will release the knee and decrease the amount of tension on the knee. We're going to begin with just raising your knee up and holding it for the count of 5, and then take it down, and then we'll Then we go to the right side, raise it up and hold it for the count of 5. And that gets the muscle ready for the technique. Next, we're going to tap using a closed fist 10 times in each area of the thigh, of the quadricep muscles, the top, middle, and the beginning of the knee. Each area 10 times, and then repeat once. We'll do it twice. Then we're going to do the gliding motion, beginning at your thigh and going down to your knee. We're going to do both knees at the same time. We're going to start at the hip and glide down to the top of the knee. And that's 1 and 2 and 3 and 4 and 5. Then we go to the outside of the knee, again bending forward. 1, 2, 3, 4, and 5. Now for the middle or the medial aspect of the quadricep muscles, we're going to slide again, beginning at the groin area and glide down to the top of the knee. And 2, and 3, and 4, and 5. Then we're going to take our hands and just using your fingertips, go around the knee, making small circles, and this will release the tendons. The circular motion we call friction that will go around the knee, and that will release the tendons that go into the muscles that move the knee. And we're going to just go around twice. And for the end stroke, we're going to take both hands at the top and glide down and around the knee and back. Glide down, around the knee and back. And last time, glide down, around the knee and back. This concludes the average person's knee self-massage.
All right. All right. Whew.
We can laugh now, but
Okay.
that was very informative, and the anatomy suit really helps to see where these muscles are. Now, a question would be, you don't need to do anything below the knee.
No.
It's all from basically the groin and the hip area down to just circling the base
Yes.
of the knee.
The anatomy of is helpful to understand how muscles work. So the quadriceps, they lead the what they're called the kinetic chain. If those muscles are tight, then the lower leg is tight. So if you release the quadriceps, you don't have to worry about because it has nothing to do with the knee. The muscles of the lower leg move the foot. So
All right.
yes. So understanding how the body works is very helpful.
Yes. And now the video was only a few minutes long.
Yes.
This is something that as a massage professional, you can take a few minutes with the client at the end of the session after their massage. Would you recommend it after the massage to just say, this is what you can do at home? Or let me show you this quick video before you leave today.
No. All right, when I changed my practice all around. They don't take their clothes off anymore. They come in, they sit down. I have a anatomical chart so they can see what the muscles look like. I demonstrate on my leg and then they do it on theirs. Because people have the tendency to give you credit. Oh, the therapist did it. But when they do it and they feel what their hands did, then they get to appreciate, oh, these are my muscles. And I came in hobbling and I'm walking out of here. And they can do it anytime, anywhere, because it's their body and you cannot hurt yourself. I've never had anybody call me and complain. They call me and thank me. And oh, one more piece. I always bring this cushion. This cushion is the type of cushion that they need to sit on at home, because if they sit the soft couch they've had for as long as they've had the house, 20 years, the hips become lower than the knees, tightening the hamstring and also causing tension on the quadriceps. The hamstrings and the quads work together. And when I give them, they buy it from me. I do it at reduced prices. But right away, they say, oh, what a difference. It is immediate. And I have them in my office. I don't sell them, but I let them experience it so they can make the decision for themselves.
Very good. And that looked like a Tempur-Pedic type filling.
These are the kind of cushion that you can get for wheelchairs, because they're soft enough, but they maintain the shape and they support. One side is softer than the other and it's square and it fits right in there and it's immediate. The pain relief, it is immediate. So it's about helping them to understand the things they need to change in their home. And I always ask them how old their mattress is, because tossing and turning the mattresses, sometimes it's a big connection for the chronic pain, and they don't know that.
Very good. Well, we still have time for
Good.
questions
Yes.
and comments. So I'd love to hear from a therapist's perspective and their client, knowing their clients with knee pain, how this would benefit. Taking a few minutes to share these techniques or the video with your clients. Now,
I always tell them, do it yourself. Always do it yourself so that you can feel the difference, because it's hard to explain it, and always let them see what the muscles look like. People don't know what the muscles look like, so they just think they're rubbing their skin and they're afraid they're going to hurt themselves. So it's about keeping them not afraid of their own body, but the empowerment of their own hands. And I'm speaking at the AMTA convention. I spoke last year, and the Holistic Nurses Association, the national conference last year, and I'm speaking again this year. So, because I'm trying to help massage therapists, especially because our profession seems to be the only one left that we have hands-on people. But the empowerment is the biggest piece, and you don't have to worry about your clients. Oh, they won't come back. They will come back, because it's nothing like your healing hands.
very good. Adele is asking, I would like to know what therapy can be done to relieve and help arthritis pain with the thumb CMC joint.
Okay, let me get to the science. I deal with the science of muscles. The thumb, the muscle that moves the thumb is, I forget the name of it, is up here. So I don't know if you can see it. It's up here.
Yes.
So you have to release this one first. This here. You come here all you want. This is not what's doing the work. It's the muscles that move the joint. So if you know contract, relax, if you know myofascial release, you start up here. And it's ouchy, but the relief is immediate. Then you can work here. So it's you start where the muscle begins and then work down to insertion.
And it sounds like you would also incorporate the tapping.
Yes.
To the arm.
Yes.
And
the
then
tapping, yes.
And then the gliding.
Yes. Yes. And the gliding can be in any direction. It's a small muscle. So the gliding, you can apply your thumb to there. It's ouchy, but the relief is immediate. But the key is to work the muscles without oil, because the oil makes you slide. And you can't, muscles are strong. And without the glide, you can increase the circulation, and again, the relief is immediate.
Now, does pinching help with that as
Yes,
well
yes.
as the glide?
It depends on some people, muscles are so tight there's nothing to grab. But even if you go anything that you can do to stimulate the circulation, you say it's pinching, but it's not, you just grab it and release. That's what it is. Just grab and release. And that's similar to the tapping. You get your body go, hello. Yeah, we're increasing the circulation. And again, the relief is immediate. So if somebody has arthritis of the hand, I begin up here. Then I work each finger and in that way, in the palms and that.
And the pump.
Yeah.
Now with the legs, you said do both strokes on the legs at the same time, as
Everybody's
opposed to
body is
one leg
different.
then the other?
Yes. I did it for the sake of time, but you can do one leg with two hands, and that is really more beneficial than both, because if a person is limping, there's imbalance. So one side is tighter than the other. So in that way, if they did, both hands on one leg, they'll be able to feel the difference in the strokes and the relief, for the balance. But thank you for saying that. Yeah.
Okay. Also, the sleep factor with the
Yeah.
pillows, like for
Yes.
knees, is
Yes.
it best to have a hard pillow under the knees?
Okay.
Or
Yeah.
do you need something by the hips, or
Yeah. Okay.
what would you recommend?
All right. So if you're laying on your back, the pillow must be firm. And it's hard to find firm pillows because every brand says it's extra firm, or this is firm and this is soft. You have to go around and squeeze the different ones, and the ones that have the memory foam, because when you go to sleep, it's dead weight. So it's going to, the weight of both legs and thighs, so it's going to smash the pillow down, and it's going to start to pull on your muscles. Yes, so, and people keep those pillows forever. Santa Claus comes and goes and nobody thinks about pillows, but that's all right. Go ahead.
I just wanted to mention to our audience that there's a few minutes left if they have
Good.
questions or comments.
Okay.
And everyone, tomorrow you will receive a follow-up email, or within the next 48 hours, and
Yes.
please check your junk folder or spam. You'll receive a follow-up email with tonight's recording and Dorothea's PowerPoint handout. I've included a link to her YouTube video that
Okay.
she showed at the end of her presentation, as well as her contact information and how you can reach her for additional questions or concerns with that. And can you do the tapping for hip arthritis as well as the SI joint area?
Okay. The SI, because that all right, usually for hip arthritis, it's one of the biggest problems is the dip in the chair and the dip in the bed. So and it's just not going to work because these muscles are so tight. If contract, relax positions, with that. But the biggest solution for that, it really is a cushion that will prevent the muscles from sinking, and because massage is just not enough. Because especially if they go back to the same chair and they don't know.
Right.
So yeah, so if in your office, if you have the pillows, in your office, if you have the cushions, it will make a big difference. It really will make a big difference, and they will tell others about you. Please believe me.
Very good. And I've seen chair yoga postures,
Yes,
which seems like that might help the hips as well,
yes, yes,
and opening them up and creating some ease of movement. So again, do you have anything final in closing?
Okay,
You said
yes.
you'd be at AMTA National.
I'll be,
Again,
I will be, he didn't tell me where it's going to be. And I think, a couple.
Tampa. I think it's in Tampa.
Oh, yes, it is in Tampa. Yes, it is in Tampa. I'm preparing my work. But there I'm going to focus on managing massage therapists, self-management of pain for their hands, their arms. And the biggest thing I would say to people, if people want to use those electronic things that pound and pound and pound in those muscles, just so I always let people know, you're pounding on tight muscles. It's not going to release it. And you're on one spot. If you release the muscle, and I never have any of those electronic things in there because people just don't, they go for that thinking, oh, it feels good, but the pain is coming back because you didn't solve the problem. That's the whole thing about these. It's muscles, it's muscles, it's muscles. I can't tell you enough. I work with athletes. Frozen shoulder, there's muscles. I know how to release those shoulders so they don't have to have surgery, because you go to a doctor, all they know is surgery, but they don't know muscles. So anyway, it's not just the muscles, it's how they work and how they work together, and then the different methods that you can use to release them.
Very good. I remembered something I wanted to ask. If you have had knee replacement
Yes.
surgery,
Mm-hmm.
the tapping and the gliding
Yes.
will help that as well.
Right. And because you're releasing the muscles, you're not
Okay.
touching that knee. And I always tell people to remember, the muscles is what moves this knee. And so if the muscles get tight again, guess what? You're going to start limping and hobbling along. Keep the muscles supple. They don't teach self-care in rehab. Oh, excuse me. I know there are people from all over, but they just teach them the exercise. But you have to release the muscles so you can exercise. And they don't have time to teach that. And that's one of the things that we can do as a massage therapist, incorporate that in my practice. Like I say, people come, they don't have to take their clothes off. It totally changed my my work. And people leave me without pain. And then they call me back and say, again, they've changed how they slept. And so, because everything is connected, it's not just where the pain is. That's where the problem is. Other things that how they're walking, their shoes, so you have to ask questions.
Very good. Well, thank you so much for sharing this
Mhm.
information. And what I'd like to do is mention our
Yeah.
upcoming EduTalks.
Mhm.
On March 5th, we have Cynthia Price presenting Integrating Interoceptive Awareness for Improved Self-Awareness and Regulation. On
Mhm.
March 12th, for the EduTalk Diabetes Series, which was launched in May 2023, we have Ruth Werner presenting dialysis and kidney transplants. Does
Wow.
massage therapy have a role?
Wow.
And then on Tuesday, March 19th, we have Dale Alexander presenting Ancient Reflexes, Biomechanics, and the progressions of aging.
Wow.
And both Ruth and Dale Alexander have presented EduTalks previously. You can find those talks in the archived library on biotone.com under the EduTalk tab. And Cynthia Price, she's bringing a new topic and she's a new speaker, so please join us on March 5th. With that, I thank you all very much. Dorothea, thank you again. And I want to mention Dorothea presented an EduTalk Diabetes series, which can be found on ease-zinc.com under the EduTalk library. And that's the Easy website, which are therapeutic dry skin products for diabetes, a lotion, and also a foot cream. And again, you can find that at ease-z.com or ease-zinc.com. Again, under the archive library for EduTalks. Thank you so much, everyone. Be well, stay safe. Join us again in March for a great lineup of EduTalks. And thank you all for everything you do for the massage profession.
Yeah.
Take care, everyone.
Okay.
Thanks again.